Ron, sure.
Good afternoon, everyone. For all of you that are with us today, I thank you for taking the time. There has been in the last hour some changes to the information that I was going to share with you. So maybe that's a good thing in one way, because I knew the changes were coming. I just thought I would be just sending them out and not explaining it to you. So I would first off like to start by thanking everyone for your support during the recent outbreak. And I just thought I would give you some information regarding the outbreak. We had 2 residents who were COVID positive, and then we had 16 staff that were COVID positive and 19 other staff that were off pending and getting results, and they came back negative. So a total of 35 staff over the period of December 18th to January 21st. So that made staffing a real challenge for us. We were fortunate in the sense that our outbreak actually started a wee bit early, so that we were able to tap into the agencies and the MESS team that RVH and Ontario Health has put together. So we got by with our staffing. We were missing a few key players, but they ended up working from home. So most people were asymptomatic. Both the residents that got COVID were asymptomatic, so that was a good thing. I did want to also mention that when the staff were tested positive, then it was our responsibility to fill in WSIB forms and inform the Ministry of Labor. And as it turns out, only 2 staff members were eligible for WSIB, and that meant that they could trace them getting COVID from the home. So basically, well, everybody else got COVID from the community. As you know, it's very rampant in the community. And that's why we're still continuing to be hypervigilant in terms of asking people to wear a mask and to wear a shield. Gowns are optional. We received 11,000 gowns yesterday from Ontario Health. We did not order them. We do not pay for them. They would not take them back to the to wherever they came from. So we had to take them. So we have lots of gowns if you need any. We will be asking other homes if they have a requirement for gowns. So that's sort of a little bit of update on the outbreak. We do also know that because it is so prominent in the community that we could go back into outbreak at any time. So we continue to do our extra pandemic cleaning, and we are testing people every day. During the outbreak, that was a really great tool to have. We were able to identify a number of people through the rapid test that were positive. They then went and got a PCR test, and they didn't actually get through the doors of the building, which was a good thing. So I will talk a little bit about the changes since we've come out of outbreak. Residents are still not allowed to go out on a social absence. This is per the ministry. You are allowed to have 2 essential caregivers coming in to visit at a time. During the outbreak, it was only 1 at a time. General visitors are still not permitted. Essential caregivers, as I said, must wear a mask and are not permitted to remove the mask for any reason while they're visiting. And we will continue rapid testing. My next subject was going to be clarification on the 3rd dose. So the ministry ended up sending out a lot of information in January, a lot of conflicting information, which gave us a real challenge in trying to put together the policy and understand what the ministry was requesting of us. What I sent to you the other day is incorrect, but it really doesn't matter because everything changed today. So as of today, and we just received this an hour ago, sorry, wrong one. Proof of your third dose or your medical exemption for either staff, support workers, student placements and volunteers, and caregivers must be given to us by March 14th, 2022. For those who are eligible for a third dose before March 14th. Now, if someone just had their second dose and that the third dose would actually take them, would be too soon, then they're to get their dose as soon as they are eligible. So the important word to remember in all of this is eligible. When you're eligible for your first or when you're eligible for your second, in this case, when you're eligible for your third dose. So I was going to be talking to you today about the fact that we haven't received proof from most people in terms of their third dose, but please, as you are getting your booster shot, make sure you give us, not necessarily a copy, but that you show us that you've had your booster shot. This is a requirement of the ministry. They're very clear on application and consequences that we have to ask people for this proof. So this was supposed to be effective as of tomorrow at 11:59. So it did mean that we had a couple of staff who did not want to get their third shot, and they have gone off on administrative leave. So now we've let them know that this has changed. They can come back. Unfortunately, they find other employment. So it does mean we have lost a couple of full-time people. So, and at this point in time, general visitors, it doesn't talk about them having to have a third shot, but they are not allowed into the home. So we will now have to take our visitor policy, which was revised yesterday, was the last revision date. We'll have to take that and redo it. So as soon as it is done, I will send out a copy to everyone, so you will not get that today. I hope I've been clear. So I want to share a little bit of non-COVID information. I was asking someone the other day, what did we do before COVID? Because our lives are so consumed with it. So I wanted to let you know that we're updating our nurse call bell system. We've been having some issues with it. So we actually are getting a new server, which we need, and we will be upgrading the nurse call bell system. So it'll have more features. And this is something that we can only do as we have available funds. So this is what we would call phase one of upgrading the system, making sure that every resident has a badge and that every staff person is receiving the appropriate calls. So that is a priority for us and will be happening in the next few weeks. We received 10 HEPA filter units from the ministry. We have placed them in high traffic areas. They're in the dining room, they're in the lobby, they're in the chalet, places where we have the most people congregating. This is great. We're just wondering who's going to pay for the replacement of the HEPA filters down the line, because my understanding is they're quite expensive. Also, they told me that they will be calling me to let me know, to ask me if I would like more. So I don't want to get a whole lot of HEPA filters in here. Once the filters are no use, they are all get stored in the back. So we'll have to look into that. I might have mentioned earlier that we received some minor capital money last year. We haven't spent it yet. So we had someone come in to measure the windows that presently don't have blinds, and that would match what we already have. So now that we're out of outbreak, they will be coming in and installing the blinds. One of the things I noticed last October when the tornado hit very close to us is there's not a lot of places we can put our residents where they're safe. So what we did was we took them out into the hallway and brought them as closest to the fire doors as we could, because that's the furthest away from the windows. But I noticed those windows do not have any blinds. So I thought, well, at least if we have blinds that we can pull down there, it might just cause and help a little bit. It'll also cool places off, which was the purpose of the funding. So they sent the money out and asked homes to put air conditioning in everybody's room. And they sent us $66,000, which of course doesn't even come close to being able to put air conditioning in the room. Meanwhile, we had applied for a grant from, forgotten the name now because it's so long ago. Anyway, we received $3.2 million for the new HVAC system on the roof. We're going to look to go into tender in February. Our only concern is the availability of the equipment due to supply chains. Most of the work obviously will be on the roof because that's where our HVAC system is. It will mean that there will be air conditioning available to residents in their rooms. We also know that many of our residents do not want air conditioning because it's too cold for them, but they will have the choice to have it or not to have it. And that means that we could free up that other money, that $66,000, and purchase other things with it related to the pandemic, cooling, infection control, that kind of thing. So we're also going to buy some new furniture with that leftover money. So this is a very sensitive topic that I'm going to talk about next. I've been asked by the nursing department to clarify something in our visitor policy, and it's related to, sorry, I'm just looking for my, it's related to palliative care end of life. So in our policy, it states that if somebody is palliative end of life, I didn't bring in the policy. Sorry, I didn't bring in the policy because it got changed. If one of my staff's watching this, can you bring me in the visitor policy, please? In the visitor policy, it talks about the fact that when someone is palliative end of life, people can come in and they do not need to be vaccinated. So we're really talking about general visitors. What you need to understand is the doctor is the one who decides when someone is palliative and when someone is end of life. The doctor may decide that someone is palliative, and they could be palliative for 6 months. So the part that you need to understand is when the resident is actively and imminently palliative and deemed to receiving end of care. So we're really talking about end of life. So if someone is made palliative, it doesn't necessarily mean that family members would be allowed in until it to the point where the doctor deemed the person to be end of life, and then you could come in. So I hope that I've clarified that. And if you have any questions, please feel free to reach out to me. The nurses do not make the decision when someone is palliative or end of life. They do have obviously a discussion with the doctor as to what the signs and symptoms are. And basically, someone who's end of life is no longer eating, drinking, taking medication, or getting out of bed, as opposed to someone who might be palliative and still, you know, going to the dining room for meals and that kind of thing. So just to let you know that in January, we hired 4 new PSWs, and we're interviewing another one tomorrow. So we've all seen a lot of faces that are brand new to us, a lot of agency staffing. We still have, as many of our nursing students had to, they weren't able to work for us because they were going into their practicum. So we're still using agency, but we're very busy actively trying to recruit our own PSWs. As we all know, we will no longer be in modified step 2 of January 31st. And we have not received any information from the ministry as how that affects long-term care. For example, I would think it would mean that the residents would be allowed to go out again, but I'm just guessing at this point. So once we have those directives from the ministry in terms of changes for that affect the residents or affect you or affect the home, I will send that out in an email to you. And I think really that's about everything that I wanted to share with you today. So if there's any questions, I'm happy to answer them.
A couple.
So the question is, for those with family members who have not received their third vaccine, children not eligible, can we do window visits? As long as you do the window visits where it's safe. So rather than going to the residence room window where there's snow and ice and snow falling off the roof, absolutely. There are areas at the front of the home where there are big windows. And what you would need to do is get in touch with Chris Burns, and she would set that up for you. So absolutely. BRHD staff have done an incredible job on keeping COVID out of the home, considering how Omicron is so transmissible. I am grateful. Thank you. You are very welcome. And the public health did comment on the amazing job that the staff did on keeping the virus out of the home in terms of our residents. So thank you. Individual air conditioning in each room is essential on those incredibly hot, stifling days with air conditioning available. At least each resident would have the choice. Absolutely. And that's why with our new HVAC system, we will have the ability to do that. And someone else just said, thanks for all you do. Another one said, thank you. You're very welcome. Any questions about your booster shot? Chris Burns, her last name is spelled B-U-R-N-S. Someone asked for Chris's contact information. And she's extension 309. Any questions about the booster shot? I guess the reason I'm asking that is because we only received about 7 confirmations that essential caregivers had received their booster shot. Now I know the date has changed, but I'm just wondering, we were concerned that tomorrow would have come and gone and we'd be telling everybody you can't come in. So, you know, if you could just give us an idea that you're going to get your booster shot, and I think that'll calm us down. We don't want to keep anybody out.
Caught up.
Yeah, I'm all caught up. So if that's everything, you will be hearing from me via email over the next week or so as things change. And somebody's brought me their palliative right now. Thank you. Sorry, I originally earlier had asked for the palliative care visitor portion of our visit policy. Yeah, it basically just says what I've already said. So I think I made it clear. If I didn't, please call me or call Jen West, who's a nurse, and probably explain it better than I can. Thank you for your time and attention. Please stay safe, especially as we begin reopening. Sorry, I've been told to look at the camera, not at myself. Stay safe, especially as we reopen. Remember, we want to keep our residents safe. So a little bit nervous about what the future might look like, but it's because, you know, it was awful having the residents in their rooms for over a month, and especially over Christmas. I felt like a warden in a jail, and I really don't want us to go through that again. It was hard on the residents. They came out and they were amazing. They never complained, hardly ever. And they came out and they looked dazed, you know? So that's not something we want to go through again. Someone's got to, if you have a third dose on record, will we need to prove on each visit? No, the ministry has dictated that you're supposed to use your QR code each time you come in. If you can just show us your QR code once, we can say if the minister comes in and says, are you following our directives? We want proof that you're doing QR code. We're just going to say we looked at it once, and then we have you checked off in our little book, and you're fine. Just one time. Okay.
So if people want to review it, it'll be on the channel. They can tell their colleagues and friends. They can review it on the channel.
If you want to review this, or someone you know has missed it, please let them know that it will be on the channel. It's been recorded, and I'm always available for questions. And I just thought there's just one more thing that I want to say. I was talking with some people, and they were saying, they were asking me a question, and I was saying, well, you need to ask the nurse, or you need to ask the doctor. And they were saying to me, well, we're not sure, like, we don't know if we should ask. You need to remember that your family member is a resident here. This is their home, and we are all here to serve them and you. And if you have any questions or any concerns, ask. If you ask someone and they can't give you the answer, ask them to ask someone else. Or if you don't get the answer you want, you're always welcome to come and see me. My dad lives here now, so I see things from a different perspective. And I noticed that with my brother and sister, they're a bit more hesitant. And I realize that, you know, you may feel that if you make a noise, then you're going to annoy somebody and they're going to not be as nice to your loved one. That is not going to happen. You have the right to ask any question you like. I would prefer that you ask us and that we resolve it, but you also have the right to complain to the ministry. I don't want to encourage you to do that, but that is your right. So whatever it is, if you want to talk to the doctor, let the nurse know. The doctor will let the nurse will let the doctor know, and they will call you. Please don't be afraid to ask a question, make a wave. That's okay, because I'm actually sometimes doing that as a family member now, not as the administrator, but as a family member. Why is nobody taking my dad's laundry down to laundry? Why is my dad's laundry not come back? Why have you not done this? You know, so that's okay, right? Especially right now when we have so many agency people, and you know, things are going to get missed. So you can ask. And on that, I'll end. Stay safe and talk to you soon. Bye.